The annual meeting of the American Society of Clinical Oncology brings together the world's leading cancer researchers to share the latest data and clinical breakthroughs for all types of cancers. Joining us to talk about it are Dr. Lou DeGeneres, President and CEO of the Leukemia and Lymphoma Society, and Loriana Hernandez Aldama, acute myeloid leukemia survivor. Good morning.
Good morning.
Good morning.
So, Doctor, what is the ASCO annual meeting and what happens there?
Well, you described it pretty well, Kelly. The American Society of Clinical Oncology meeting is the world's largest cancer meeting, bringing together 40,000 physicians and scientists from all around the world to review the latest data in clinical trials and research in the pursuit of new treatments for cancer.
And what was the big news at this year's ASCO meeting?
There was lots of exciting news, but I'll highlight two things for you. One is in the arena of something we call immunotherapy, using the patient's own immune system to find and attack and eliminate the cancer. At the Leukemia and Lymphoma Society, we helped to pioneer that treatment in leukemia and lymphoma, and now I'm really pleased to be able to say it's being tested in other forms of cancer as well. I think that the second thing that I would highlight from the meeting is discoveries that show that a single targeted drug, a single drug that targets a single bad acting gene that drives cancer might be useful in treating many different forms of cancer, no matter where they occur in the body.
Now, what is Beat AML and how is that unique?
Beat AML, acute myeloid leukemia, is among the most aggressive forms of leukemias. Actually, it's among the most aggressive forms of cancer. It is the most frequently diagnosed cancer in adults in the United States today, over 20,000 new cases a year. Sadly, we haven't seen an advance in the treatment of AML in close to 40 years. Beat AML is a Leukemia and Lymphoma Society initiative to run a clinical trial to develop new treatments for AML patients like Loriana here, who's joined me.
And what is the next big thing in cancer research?
Well, there's lots going on in cancer research, and I'm very excited about it. One of the things that excites me the most is our ability to use combinations of powerful drugs. We're taking really a card from the deck of how we've learned to treat infectious diseases, where we use more than one antibiotic simultaneously to knock out the bacterial infection. We believe that the same kind of approach can be applied in cancer. A cocktail or a mixture of drugs, two or more very potent drugs, could provide the 1-2 knockout punch that's really required to cure cancer.
Now, Loriana,
and Kelly, I'll add to that
Yes, I was just going to ask you, Loriana, about your situation, AML, and your story.
Well, we need that 1-2 knockout punch that he was talking about. We need something. I have a lot of hope. I am an AML survivor, acute myeloid leukemia, and as you heard Dr. Lou say, there hasn't been a change in treatment or much progress in 40 years. And as you know, as a reporter, you're a reporter, I'm a reporter, that to me was astonishing. I couldn't understand that how, when they told me you have AML, it's a blood cancer, and we're going to take away your 2-year-old son and you're going to be in the hospital for a year if you get out alive, I thought, how could that possibly be? I covered so many other medical advancements in my career in 20 years. It just seemed unacceptable. And it was a really rough year. It was tough for me. 10 months into the treatment, they said, you know, there's nothing else we can do for you. You're in remission, and just pray that really, in their terms, like the shoe doesn't drop and you don't come out of remission, or you'll succumb to the disease and die. And that's where I found the LLS-funded study that looked deeper into my bone marrow. And I said, sign me up. I want to see how this works. And they called and said, your cancer's coming back. We're going to throw you into transplant. And thank goodness that I signed up for that trial, and thank goodness that people funded it, because it helped save my life. I'm 2 years post-transplant, and because of all the chemo, the more fit you are, the more chemo they'll give you, and I was in the best shape of my life. So I'm now alive and broken, but I'm happy to be here. But I'm one reason that they need some breakthrough therapies. We need more people to survive, and those who do survive to not suffer like I suffered and the way I still suffer 2 years later. So my message really to people is that my story could be your story. And the irony of all ironies is 10 years prior to my diagnosis, I helped fund really my own fight because I signed up for LLS for a team and training program 10 years prior to run a marathon. And to me, it was just a good cause to just go run and burn some calories. And little did I know how serious AML was and really how important those funding dollars were. So it's really the time for people to get involved. They're on the cusp, and I'm here because I have a vested interest. I now have a 5-year-old who has PTSD and wants to have a mom as he grows up. And my story is the same as so many others out there who have loved ones fighting. And we need more people to survive.
Well, thank you so much for sharing your story. And where can people go for more information?
Kelly, let me give you 2 places. The Leukemia and Lymphoma Society website, that's lls.org. And if you're a patient, we can help you now. Give us a call at 800-955-4572.
Thank you for your time.
Thank you, Kelly.
Thank you. Good day.
Mike?